Hey guys, it's Julian here. I told you guys I would update you on going to see that specialist, that new specialist. I work at a hospital. I'm actually a patient care technician, and I actually was referred to him by a doctor, but I also heard about him through patients that are older. They would tell me like, go see him. Sorry, excuse me. Go see him. He's great. That he helped them. Interesting things happened when I went and seen him. He told me he was baffled by me actually. He looked at my caloric scans from my previous ENT, and he said that my symptoms were not, typical. They're atypical, making him think that maybe it's more of a neurological problem or something like that versus my ears. So basically, the update is I'm coming back in a month to do a caloric test. He's going to do it on me because he said that my caloric test I had done with the other ENT basically showed that I probably had like damage to my inner ear due to ototoxicity, I guess, is where you take like an antibiotic, like mostly intravenously, and it damages your inner ear. But I told him, I don't really even take medicine. Like I haven't had any antibiotics. I barely take Tylenol and Advil. So he was baffled by that. So he suspects other things besides my ear. He said that typically patients who are suffering from maybe Meniere's disease, they have the fullness in the ears, like when they have an episode and it's like bad fullness, or there's like ringing in that ear. And they can say, hey, it's this ear, or hey, it's this ear. And, and I told him I can't really tell you what ear it is. Basically, I've had fullness like 3 times in the 6 years that I've had vertigo in this ear. 3 times. And it's not even bad fullness like what I see some of you complaining about. It just kind of feels like it might be blocked a little bit. Not even that much. I do get headaches a lot, almost every day. He said it could be a migraine problem, which you'd have to see a neurologist about that. He looked at my MRI. Again, in my last video, MRI is clean. CT scan of the temporal bone is clean. No tumors, no acoustic neuromas. So, really, he's baffled. The update is I'm going to go back in a month. He's going to do another caloric test on me. And it's kind of bright. I'm gonna put these on. He's gonna do another caloric test on me, and he's gonna test me, and he's going to see what he gets off of that, and he's gonna try to rule out my ears. If it is my ears, he's gonna do a steroid injection into the affected ear that he thinks is infected, or infected. I meant affected, into the ear that he thinks is affected. And that might help. In order to do that, I'll have to go up to Birmingham for like a whole week to do that, because they do it several times over the full week, and I have to sit in a chair for 3 hours. If he rules my ears out, he's gonna send me to a specialized people that treat or test and treat dysautonomia, which is, I guess, like a problem with the it's a problem with the autonomic nervous system. Like, it controls heartbeat, blood pressure, things like that we don't control with our mind. We subconsciously control it. There's like 15 different types of dysautonomia. Personally, I don't think that's my problem. But I'm so desperate at this point to figure out what it is. I'm down for like anything, just to see, So, when I was talking to him, I told him, my symptoms, again, back to the atypical, I told him, I just feel off like almost all the time, 95% of the time, on and off. I'll feel floaty throughout the day, sometimes all day. It's like something isn't communicating up there properly. When I feel like I'm floating above my body, I get like slight rotational vertigo when I'm, just throughout the day. Sometimes I get bad episodic vertigo attacks that debilitate me and I can't walk. When I do try to walk during these attacks, I feel like I'm like falling like in my body. Like if you you've had a caloric test before, you know, it makes your body feel like you're falling. That's the sensation that I get when I have these vertigo spells. And basically, you know, again, he just said that that's strange. That's, you know, for it to be happening, be as dizzy as much as I am, you know, especially at my age, you know, 23 years old. So he's baffled. That's the update. He's baffled. He told me we are going to figure out what's wrong with you. It just might take a little bit. I hope they can. I'm really hoping they can. I really desperate. Like I said, I just want to figure out what it is. I want to be able to treat it and be done with it, so I can continue to move up in life. Right now, it's making life hard for me. So, you know, it's a struggle. And all you out there that have the same problem as me, I feel your struggle. I really do. You know, I'm a father, and I just find it hard to find the joy in life lately. You know, I don't know. So we'll see. We'll see if they can figure it out. I hope they can. They're even maybe suggesting like a spinal tap of the, you know, to test the cerebral spinal fluid in the brain, to test for certain issues. You know, I'm afraid of doing a spinal tap, but at this point I would do it just to figure out if maybe, you know, they can find something out through that. For all you that I've seen a lot of things on the Meniere's Disease Forum on Facebook. I'm gonna share a little knowledge with y'all. So I seen my neurologist, and he mentioned something called superior canal distension. That's when you have like a hole in your bone, or a hole in one of your canals or something. It's a small something of that nature, and like something to do with the fluid leaking out, or something of that nature. But the symptoms of that are like noise causing vertigo. Like loud noises will cause vertigo. You can hear your own heartbeat. Just things like that. So if any of you have symptoms like that, you might be able to ask your doctor or your neurologist to schedule you a CT of the temporal bone to see if that's your problem. I believe that one can be surgically fixed. That's just some knowledge that from me to you that I found out through my neurologist, that I was seeing, but I'm not anymore, because I honestly didn't care for him. He didn't seem to care about me. He didn't seem to care. So I'm done. I'm gonna let my ENT in Birmingham schedule me with somebody he knows around the UAB area. But that's the update, guys. I appreciate you. I'll continue to keep you informed. You guys are great. Thank you for being with me in this time, and just, I'm trying to keep my head up, and you guys keep your head up as well. This is a challenging, debilitating disease or problem. A lot of people don't appreciate or respect their vestibular systems because they don't know what it's like to have a faulty one. Again, thank you guys, and I'll keep you posted, and y'all have a wonderful, blessed day.